Unplugged in. Dozens of cities on lockdown. The world on high alert after the horrifying discovery of a highly contagious virus in the Chinese city of Wuhan. The death toll is rising with new cases diagnosed daily in China, in the U.S., and around the globe, as Beijing attempts to limit travel during China's largest holiday celebration. What are scientists and health experts doing to stop the deadly virus? And what do you need to know to protect yourself? Unplugged in, China and the coronavirus outbreak. Hello and welcome to Plugged In. I'm Greta Van Susteren. The World Health Organization says it is still too soon to call it a global public health emergency. But the new virus, first discovered in a food market in the central Chinese city of Wuhan, is spreading. The death toll from the new coronavirus is rising dramatically in China, and the numbers of people infected around the world keeps rising. China is locking down entire cities, creating a quarantine of nearly 60 million people. All this as China's largest holiday migration, the Chinese Lunar New Year, gets underway. What do we know about this deadly virus, and what do you need to know to protect yourself? We begin with VOA health reporter Carol Pearson.
People from China are being screened at airports, both in their country and abroad. They're being checked for fever and other symptoms of a new respiratory virus. The virus is a coronavirus, so called because it appears to be surrounded by a crown. The common cold is one example of a coronavirus, and so are deadly respiratory viruses like SARS, severe acute respiratory syndrome. It originated from animals, civets, at a food market in China. Then came another coronavirus, the Middle East respiratory virus, known as MERS.
MERS probably was from bats, but now is endemic in camels all over the Middle East and spreading from camels to humans. So for all of these emerging coronaviruses, they all have an intermediate host that allows the virus to jump from animals to people.
This latest coronavirus is associated with a food market in Wuhan, a city of 11 million people. Respiratory viruses are airborne, transmitted by coughing or sneezing, touching an infected surface, and then touching your mouth, nose, or eyes. Freeman says it's easier to catch a coronavirus than it is to catch Ebola, which spreads by bodily fluids. So far, this new virus doesn't seem to target any one group, but age has its disadvantages.
If you're elderly, 65 or older, you have a greater chance of complications. But there's no age restriction on this.
Complications can include pneumonia, bronchitis, kidney failure, fluid buildup in the lungs, and death.
If you wind up getting a secondary bacterial infection, you can get put on an antibiotic. If you have respiratory distress and you need help with breathing, you could be put on a respirator. But there is no proven specific effective treatment for the novel coronavirus.
Scientists around the world are studying this virus.
What we need to know next is where the virus came from. And then the next steps are really looking at what this virus does, how it causes disease. Can we develop diagnostics to the virus so we can better understand how it spreads in the community?
In the meantime, the CDC recommends frequent hand washing, coughing into your elbow, or a tissue, and if you suspect you have the virus, contacting a doctor. Carol Pearson, VOA News, Washington.
U.S. health officials say they expect more coronavirus cases worldwide, but they say the threat level to the American public remains low. Those same health officials also say that China's response to the outbreak has been good, but they added that having U.S. medical teams on the ground to help the Chinese is strongly recommended.
Right now, there is no spread of this virus in our communities here at home. This is why our current assessment is that the immediate health risk of this new virus to the general public is low in our nation. The coming days and weeks are likely to bring more confirmed cases here and around the world, including the possibility of some person-to-person spread. But our goal of the ongoing U.S. public health response is to contain this outbreak and prevent sustained spread of the virus in our country.
So first, having lived through the SARS episode, I can say that the posture of the Chinese government, levels of cooperation and interaction with us is completely different from what we experienced in 2003, and I want to commend them for that. They are still obviously learning, just as we are, about a rapidly emerging infectious disease situation, but getting WHO, CDC experts on the ground to be able to assist the Chinese experts. This is a major issue, major public health issue, and we basically just need the best public health people we have in the world working on this right now.
As you've heard, the epicenter of this outbreak is a wild game market in Wuhan, one of the largest cities in central China. Since then, Chinese authorities have ordered a temporary ban on the sale of wildlife. It is not the first time wildlife markets have bred new diseases, and experts say it won't be the last. VOA science reporter Steve Baragona explains.
Wild animals are spared from dinner tables for now, as Chinese authorities crack down on game markets. Officials are temporarily closing markets that sell wildlife for food. The same thing happened in 2002 after civet cats at a live animal market in southern China infected people with SARS. That outbreak ultimately killed 800 people.
So it's very disconcerting that we can't seem to learn this lesson about where this risk is coming from.
Veterinarian William Karish is vice president of EcoHealth Alliance. He says live animal markets pack lots of stressed out animals together in a small space. It's a perfect environment for spreading disease.
Now, most animals, of course, are not infected and are not shedding viruses, but it only takes one or two. And as they come to a market where it's crowded, there's other live animals there, they can start spreading it around. It's like kids going to kindergarten. One of them shows up sick, and next thing you know, everybody else is taking it home to their parents.
Karish says game markets especially can breed new diseases because they bring together animals and their germs that would normally never mix. It's a golden opportunity for a germ to find a new species to infect. Thousands of animals pass through these markets every day, and there are thousands of these markets around the world with millions of shoppers. With numbers like that, Karish says,
the chances of one virus making it through, winning the lottery, and getting into people is pretty high.
People don't always shop at live markets by choice, Karish says. When there's no refrigeration, it's the best way to know your meat is fresh.
So it's almost safer to see an animal that's live. It's alive, it's healthy, no one found it dead on the road and now is trying to sell it to you as good meat. So there's rational reasons why that exists. But that world is also changing.
Around the world, supermarkets are replacing live markets. Their offerings may be less exotic, but Karish adds they're safer for everyone. Steve Baragona, VOA News.
What is becoming evident is a critical role science and new technology are playing to help limit the spread of this newly discovered strain. First, in identifying the pathogen, and second, developing effective treatment. Steve joins me. Steve, I'm going to first talk about your reporting. Your reporting says SARS had about 800 deaths, or 200 deaths, killed 200.
800 worldwide.
Or 800.
Yep.
And then this is between the new coronavirus is just a little over 100 right now. And the CDC estimate the flu season, this is an estimate, will have 8,200 estimated deaths. So are we, we're preparing ourselves, or are we scaring ourselves?
I think this is a tightrope that health officials always walk. They're always on the lookout for the next big one. And you never know where it's going to come from. But at the moment, this is not spread in the same way that, let's say measles is. Doesn't spread as easily.
That's more contagious. Measles is more contagious.
Way more contagious. The death rate is high for an infectious disease, but it's, not as high as Ebola, for example. I think the biggest concern with this is that there's just a lot we don't know at the moment. You put it in perspective rightly. I think it has not killed as many people as the flu does every single year. But we feel like just because we see the flu every year that we're familiar with it, and we kind of discount the overall toll that it has. This is all new.
All right, so what are we doing? And the U.S. is helping, but the world is helping, and they're able to identify this actually quite quickly, that it's the coronavirus.
Quite quickly. That was kind of remarkable. They, It was first announced on, I believe it was the 31st of December was the first time that China told everybody, okay, we've got this new disease. A week later, on January 7th, they announced they had the sequence, the kind of DNA code of the virus. Once you've got that DNA code, you can get to work on developing treatments and vaccines. A week that's super fast. Still no treatments, still no vaccines, but the pace of discovery at this point has been pretty fast.
And China has quarantined the city of Wuhan?
They've tried. They did say that when they first quarantined the city, before they were able to kind of really clamp down, about 5 million people got out, which is, not a small number.
Not insignificant.
Not insignificant. But at the moment, they seem to be locking things down pretty tight.
How much is the world helping on this? I realize the United States is, we've got the CDC, we've got a lot of our scientists working on it, China's working on it, but what about the rest of the world?
Well, the World Health Organization is really in the lead on this, and just yesterday, the Director General of the WHO and the leader of China met, and China agreed to allow international experts in, which is something that they have not done to this point, and that's a big step. There's a lot of experts around the world who are very good with this stuff, who've been through this many times, and having them on the ground should be a big help.
Well, there was criticism, I remember, during SARS that, for instance, China wasn't completely candid about the crisis and about the magnitude of it. Is there a sense that China is playing it straight, telling us everything they know, notifying the rest of the world when this was identified as a potential crisis?
Yes and no. They've gotten a lot of praise for the way that they've handled it so far compared to the way they handled SARS. But there still are a lot of concerns that I think partly because transparency is not one of China's strong suits. There are still a lot of concerns that we're not getting everything, all the information that we need to know. Health officials yesterday were asking the Chinese for more cooperation with things like they want to see the raw data of how this virus is spreading from person to person. And China, at least as of yesterday, had not shared that data yet.
And why wouldn't they share that data? I mean, any known reason why they wouldn't give that, share that?
I don't know.
And the interesting thing about the reporting is that Ebola is less, this is more contagious than Ebola.
Oh yeah, absolutely. I mean, Ebola is hard to get. You got to get in touch with somebody's blood. This is
or
definitely...
Or touch their bodily fluids.
Yeah.
This is just droplets. It's sneezing.
Droplets, not airborne, and that's important. It's it's in your sneezes or your coughs or something, but it's not just floating through the air. That's one of the things that makes measles so contagious. This is not the case with this virus now, which really needs a better name. It's droplets right now, and if you don't come in contact with those droplets, it doesn't seem to be likely that you're going to get the disease.
Steve, thank you. Steve Barragona, VOA science correspondent.
Happy to do it.
So is the world doing enough to stop this coronavirus from spreading further? And what is the United States' role in developing safe and effective treatments? Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, says the outbreak is serious, and he says scientists around the world are doing everything they can to control the virus before it is too late. Dr. Fauci spoke with Plugged In's Mil Arcega.
The outbreak is very serious. There are travel-related cases in multiple countries throughout the world, including the United States, that has 5 travel-related cases. Fortunately, we've been able to handle them in a way of identifying them, isolating them, and doing contact tracing. So there's no spread from one person to another. And there doesn't appear to be spread from person to person outside of China, although there are several travel-related cases.
Doctor, is it still too early to call this a global public health emergency?
It really becomes almost semantic. It certainly is an emergency in China. And as you get cases outside of China, you're going to wind up having more spread because there's no reason to believe that the virus is going to act differently in Thailand, Japan, Singapore, and South Korea than it's acting in China. So I don't want to outguess the WHO and when and if they declare a public health emergency of international concern, but they're going to have to meet again and reevaluate this because things really look very serious there.
Doctor, I want to get back to your points about China. It has received some criticism for not being transparent enough, but from what I've seen so far, China seems to have taken sort of a more proactive stance than it has in the past? I'm talking about the response to SARS, for example, and the bird flu.
Well, I think you're absolutely correct. You know, I have been involved with interacting with them way back for many years, including the 2002 SARS outbreak, as well as the pre-pandemic flu outbreaks. If you compare what the transparency is now with the novel coronavirus with what it was in 2002 and 3 with SARS, is orders of magnitude different. They were egregiously non-transparent back then, leading to a major delay in an adequate response. That's not the case now. They are definitely much, much more transparent than they were back then, but we still don't have firsthand knowledge of what's going on there because it still is very much a closed situation. They're reporting on a day-by-day, real-time basis what's going on, but as a scientist, I would like to see the data myself. So I can't guarantee and confirm what's going on there. I could only say, comparatively speaking, they've been much more transparent now than they were then.
What about the U.S. response so far, Dr. Fauci, limiting ports of entry, for example? Is that enough?
The airports here in the United States that are doing active screening, which captures not all, but a substantial percentage of the people that are coming in from Wuhan, which is the area that's predominantly involved in China. Those are the kind of things that have worked in the past, that kind of active airport screening. It's called entry screening. The Chinese are doing exit screening. In fact, what they have done is something even more dramatic than that. They've cut off all transportation, air, train, and ferry out of Wuhan.
What do you think the U.S. contribution to this health crisis is going to look like when all is said and done?
Well, we have always been, throughout most outbreaks and pandemics, the leaders in developing countermeasures in diagnostics, therapeutics, and importantly, vaccines. We're not the only ones that are doing that, but we are a major player when it comes to developing these countermeasures in response to the outbreak. This is a moving and evolving situation that could turn out to be much worse than it currently is at the present time.
So what do people need to know about coronavirus? Who's at risk and what can they do to protect themselves?
Well, right now, if you're in China, particularly in Wuhan, you're at a considerable risk. The risk for the American public right now is low. That could change if we start getting a lot of cases that spread human to human. So right now, the evaluation is that the risk is still low. But we have to take it very seriously because it could evolve into something that's much more difficult to control. Well, I mean, obviously, we're making a vaccine. We have the sequence. We have the specimens now from 5 people who are in this country, and we're doing research based on that information and that material.
Okay, this is going to be broadcast to a global audience. Dr. Fauci, is there anything else in your mind that you think our viewers should be aware of?
Well, I think that this is still a threat, and we need to pay serious attention to it and take it very, very seriously. I mean, hopefully it will be contained, but it could turn into a global pandemic.
Hong Kong, a city of 8 million, has temporarily closed some of its borders to mainland China. It has also stopped issuing travel permits to Chinese tourists. But the travel bans and the lockdowns at the height of China's busiest travel season is having an impact on local economies and workers at tourist destinations throughout Asia. Reporter Steve Sanford has more from southern Thailand.
Last year, Thailand's tourism industry welcomed nearly 11 million Chinese visitors, boosting a sluggish economy. But signs of caution were evident on the faces of some tourism workers, worried about the spread of the coronavirus.
Some foreigners saw the mask and were afraid to come because they thought I was sick, but now they understand the situation. I wear a mask to protect myself, not because I'm sick. Right now, when I see a Chinese customer, I'm okay, and I don't reject them because I am providing a service.
Despite a clampdown on people leaving Wuhan and neighboring Chinese cities, Some airlines were still flying passengers home Monday to see their families.
I will just stay home for now because it's still a critical situation out there. So I'm really worried about this problem, and so is my family.
Despite a rising number of suspected cases, along with news that the virus can lay dormant for up to 14 days, government officials remain confident that the crisis is still under control.
Right now, we're at the second level of 5. If there are any increases in Thailand of human-to-human transfer of the virus, we will bring the danger level up.
Still, many of the seasoned tour guides who experienced the harsh financial effects of the 2003 SARS crisis say that safety should come before profits.
The owners of the tourist company should understand the situation. If we only worry about the income of the country or businesses, or even for myself, this is not the right thing for us to be concerned about. Otherwise, bad things will happen.
Steve Sanford for VOA News in Krabi, Thailand.
Aggressive strategies like travel bans and quarantines may seem the right thing to do, but my next guest warns such actions can also bring unintended political, financial, and social consequences. Lawrence Gostin is a professor of medicine at Georgetown University. He's founding chair at the O'Neill Institute for National and Global Health Law. He is a member of the World Health Organization's Advisory Committee on Pandemic Diseases and served on 2 global commissions on the 2015 Ebola epidemic. Welcome to Plugged In.
It's a pleasure. Thank you for having me.
The key word is unintended consequences. Let me focus first on the China-U.S. trade deal. We're into phase 1. Could this outbreak have any impact on that?
Well, it shouldn't. In fact, if it were possible for the U.S. CDC to go in and enforce in China, I think it actually could have a wonderfully a beneficial approach from not just from public health, but diplomacy. It would signal to China and the world that you can have different politics, different ideologies, but we come together as a nation, as a world community together. And so I would love to see U.S. involvement. I think it could, if we played this right, it could improve our relationship with China.
We see that often, like with world catastrophes, whether it's a typhoon in some other country, is wiping out some city or on some island, or in the Japanese, we were over there helping them with the tsunami. So we see a lot of that diplomacy in the face of a country. Is China not welcoming U.S. help in this?
Well, China just announced very, very recently that it would allow foreign help, but it's hasn't specified that. WHO's Health Emergencies Program probably, in going forward, will have a presence, but how much of a presence is yet to be seen. President Trump has offered U.S. assistance to China, but it's very, very unclear to what extent there will be a real cadre, a surge of international experts in China that have real, power and authority and expertise on the ground.
Well, the clock seems to be ticking while they're all thinking about whether or not, China will accept more help and whether, what the other nations are going to do. I mean, the clock is ticking.
It certainly is. In China, you have to, from their point of view, there's probably nothing more important to Xi Jinping and the Chinese government than projecting an air of, I've got this under control, competence, technical capacity. And so to let a large cadre of foreign experts in, or if the WHO declared an emergency, I think that it would tarnish the image that China has had.
Well, we've got several issues. One, of course, is the quarantine of an entire city of 11 million. I mean, you've got that social consequence. You've got British Airlines, they've pulled their flights in and out of mainland China. The U.S. is evacuating people. Other nations are evacuating people. And then also in our reporting that China is doing exit screening, which when I hear the exit screenings, I thought, well, what if you're in that 2 to 14 day incubation period? What good is exit screening going to do you?
Well, in fact, exit screening will not pick up people who are asymptomatic, and so
who don't show they're sick.
Who don't show they're sick. That's right. And as far as the mass quarantine in Wuhan and Hubei province, I mean, this is unprecedented in the history of the world and could only happen in China. if you think about it, more than 50 million people are trapped in a zone of contagion. It could provoke fear, panic, and the first rule of public health is to gain the trust and cooperation of the population. And I think these kind of mass restrictions won't do that.
Well, I imagine that people are so worried about food, because if in a quarantine, things have a difficult time getting in and out. Supposedly, nobody's supposed to get out in a quarantine. But is food being brought in and services? I mean, is the city still, Wuhan still running like a city, but for the fact you can't get out?
No, it's anything but running normally. I mean, there are some supermarkets are well stocked, others aren't, but food prices have gone up. Clinics are overrun. There's shortages of essential medicines and medical equipment. I think the Chinese government is doing all it can to actually bring reinforcements in.
But that's where you get into that, if they need help, if a country is willing to help, be willing to accept it.
Yeah, I mean, I think the help that China really needs is technical public health capacity to do testing, screening, treatment, isolation, and really to find out, have a genuine idea who's been exposed. It's shocking that so many hundreds, if not thousands, maybe millions of people have left China that were not on any known contact list.
What do you make of the fact that the CDC projects 8,200 deaths from the flu season? That's just as I say, the ordinary flu. It's probably nothing's ordinary, and this has only killed over 100 and some. I don't mean to demean it by saying only 100, but the numbers are dramatically different.
Of course.
100 and a few with coronavirus, and 8,200 projected with the flu.
Yes, I mean, that's a very good point. I mean, certainly SARS, MERS, influenza have much higher death rates. So far, the death rate, as far as we know it with the Wuhan coronavirus, is relatively low. But nonetheless, we expect flu. Flu comes every year. It sweeps the globe. We try to get a vaccine and do the best we can. This is an entirely new, novel virus that could mutate, and we really do need to take it extraordinarily seriously.
And I think that's what Dr. Fauci said and others said. Just as a sort of a personal note, is that always in these situations, as a journalist, I don't want to scare people. I don't want to overhype something. I want to make sure that they have the right information so that they can take precaution. But we're all sort of in uncharted waters trying to figure out what to do. And I'll take the last word. Anyway. Thank you very much for joining us, sir.
Pleasure.
Lawrence Gostin, Professor of Medicine, Georgetown University. And before we sign off, we want to pause to reflect on the tragic death of a sports icon known around the world. On Sunday, U.S. basketball star Kobe Bryant and his 13-year-old daughter Gianna and 7 other passengers died in a helicopter crash near Los Angeles. Bryant played his entire 20-year career with the Los Angeles Lakers. He retired in 2016. His accomplishments were extraordinary, including 5 NBA championships, 2 NBA Finals Most Valuable Player awards. He was an 18-time NBA All-Star, and he won 2 Olympic gold medals. And in retirement, he did more. He became a successful businessman, writer, and production executive, including winning an Emmy Award and an Oscar. Having spent his entire childhood in Europe, Bryant was fluent in Italian and Spanish and loved international soccer. Kobe Bryant was 41 years old. He's survived by his wife and 3 daughters and the millions of fans around the world who loved him. That's all the time we have for today. Stay plugged in by liking us on Facebook at Voice America. You can also like my Facebook page at facebook.com/Greta. And do follow me on Twitter @Greta. Thank you for being plugged in.